So due to the nursing shortage that we're going to be facing, we developed a career ladder initiative where we can help individuals start off their career such as a resident assistant or a CNA and move up into a nurse practitioner if that's what they're looking to do.
The career ladder is an opportunity to develop yourself within the healthcare field. Our whole goal was to recruit people within the healthcare field. Another goal was to support them through as they go from CNAs all the way to nurses. And it allows us to help people live their dreams of becoming successful within the healthcare career. All candidates start at the CNA level. Following that, they can continue to grow within their nursing career all the way up to LPN, RN, nurse practitioner. It's up to the candidate how far they want to go within their schooling within the career ladder.
The flexible scheduling is great because each semester departments are able to work with the student to say, what does your class schedule look like this semester? How can we make sure you get the hours that you need to be able to support yourself, but then also to give you that work-life balance and allow you to do your homework and then be able to help even with the residents.
I was able to work just the weekends if I needed to, or pick up extra hours if I needed to, and they would change it each semester depending upon what my needs were for school.
On-the-job training is great because you get to do things hands-on that you're also learning in school, and it starts to make more sense and it starts to make things click for you, and so you get to ask more and more questions and learn consistently throughout your schooling.
Definitely get that patient one-on-one. You're more willing to help. You understand what the CNAs are going through. It's not just, you're focused on your medication passing and, your treatments and everything. You are also well-rounded with taking care of the residents.
For me, it's vital. The little details in patient care that you might not be taught in the nursing program are the things that you learn as a CNA. The patient care that you become used to and comfortable with, I don't think you necessarily get taught that in RN school. As a student, in my clinicals right now, I walk into a room, I'm instantly comfortable with, I know how to do their basic cares. If you don't start as a CNA, that might take a little longer to actually get a grasp on.
Tuition reimbursement after 6 months of being employed, you're eligible for either $2,000 or $3,000 a year to help cover expenses. So if it's books, registration fees, or even the class expense itself.
It's been wonderful. Get good grades, do your work, show them that you're putting in the work, and they hand you a check.
Had it not been for BDCH in the hospital, I probably would not have gone back to get my nurse practitioner. When I did, there's a lot of encouragement to go back and continue my education from my director and my peers that I was working with at the time.
She knows that I have a goal, and I like that. I think that's her goal too, to let us continue on and to grow. I think she knows that we want to, at least I want to stay at Beaver Dam Community Hospital. I want to keep working here.
No, I knew they would work me in somehow, some way or another, and then during, I think it was my last semester, they did offer me a position when I was done with school.
Oh, I highly recommend they go through the career ladder because they'll be able to understand from start to finish what the career's like and those team members that they'll be working with throughout their career.
I think starting at the bottom and knowing the basics really helps you in the long run as you work your way up the ladder. You're more supportive, or you're able to be more supportive of those staff that are just starting out. It's very hard to do the registered nurse job without knowing the basics and understanding the basic care, and I think you get that compassion that you need, and you learn those skills first before you have to make life-changing decisions. And
well, I would recommend it because you can better yourself. You work your way from CNA and work your way all the way up and get a perspective from every level. The organization is, as a whole, is great. They offer clinics and everything, and it's nice to work for a place that you can also have a doctor in the same facility, and I think they're always willing to work with people as far as school, or they're always encouraging and supportive of advancement, and always trying to build your confidence.
Overall, I just like the organization. I like the leadership, the values that we believe in, and just that constant strive to give the best care to the residents and patients.
This is an environment that really wants to foster your growth. They're all part of a team that wants you to move up and move on, move ahead within this organization. This is the right thing, this is the right spot.